Tonight, we have the rare opportunity to hear from some of the key decision makers inside Colorado's response to COVID. The women calling the shots during an unprecedented crisis. They sat down with our Anusha Roy.
Jill Hunsaker Ryan, and I'm the Executive Director.
Brandi Emily, I'm the Health Equity Branch Chief.
Rachel Herlihy, I'm the State Epidemiologist. We are probably first trained scientists, epidemiologists, laboratorians, public health leaders, happen to be women.
Our whole epidemiology lead team was women.
What makes this response, I think, historic is probably how many women were in leadership positions.
There were a lot of women involved. Of course, there were a lot of very successful men involved.
When that first confirmed case was detected in Colorado, what was your first thought?
I remember I was alone in an office at the State Emergency Operations Center, and it was late evening. I was by myself, and I actually got a little emotional reading it. That y-axis went out 18 months to 2 years, realizing what this was going to look like, how many cases there were going to be, and how long this was going to last.
One of the things that we saw play out during the pandemic was that a lot of moms did have to leave their jobs, right? They were choosing between childcare and their careers. So how much was that a part of the conversation within CDPHE?
We are all mothers. Many of us had young kids at home during all of this. You know, you would be on Zoom calls and there would be kids in the background, and that was just accepted.
When you looked at, kind of the domino effects of what COVID did and the way people had to change their lives, what was the impact on you guys?
Something that has weighed heavy on me throughout the pandemic has been this need to ask more.
It's been hard to watch a little bit, the level of burnout is real.
We really only put the harshest restrictions in place to protect the hospital system.
What did we learn from this pandemic as we prepare for the future?
There's this popular study that goes back decades and decades and has tracked this tendency for children to draw scientists as men versus women. Over the years, you've seen an increase in the proportion of children that draw women.
Representation matters, and I'm a mother of 4, and it's always been very important to me to be influential in their lives and to show them that you can be a mom and you can be very successful in your career. Seeing us walk the walk means something in the community.
So when Dr. Herlihy was talking about that study of what kids think of when they see a scientist, she was also talking about how this was a really unique opportunity to show women in these leadership positions over a really long time, not just through the press conferences that we shared on this show, but amongst themselves and what their kids were watching at home, Kyle, because like they were mentioning, they also had children in the background watching their moms lead their way through COVID.
And we talk here about lessons learned. They're the women who are actually in charge of taking those lessons and implementing them as quickly as possible to protect Colorado's health in the future.
Right. I mean, it's not about staying stagnant, right? So one of those ideas is that health equity branch that you heard about that was just established less than a year ago. Also making CDPHE's data systems more modern, scaling up their staff to be prepared for the future. We heard about CDPHE adding as many as 1,000 staff plus another 1,000 contractors very quickly to be able to respond to major crises like what we saw in the last 2 years.
When you hear Dr. Herlihy talk about the dread she felt when she saw the early models of the disease, brings us back. All right, Anusha, thank you.